Okay, it is 9:01, so we are going to go ahead and get started. Welcome, everyone. We're glad to have you at Davis Links today, and we have a really exciting outline. I'm excited to hear our speakers today. And things are focused on early child care and the child care options in Davis County. So we're going to start off with Travis. Will give us some Davis Links updates. Travis, I'll turn the time over to you.
Yeah, thank you. I'm Travis Olson, again, Community Outreach Planner with Davis County Health Department. I haven't met you already, so welcome. I just wanted to start off by sharing this event, the Grief Literacy Training. Registration needs to be completed by May 4th, and you can scan that QR code. And by the way, all the slides are always made available in a follow-up email, and this is always recorded for virtual meetings and put on our YouTube channel, which also will be shared after the fact. So this grief literacy training, we know that grief literacy is a very important topic in our community, and it will be held Thursday, May 14th from 11:30 to 1 at the Davis County Memorial Courthouse, which is by the Davis County Admin Building, where we've held in-person events for the resource forums in the past. And then the next forum is Tuesday, May 26th from 9 to 10:30 in the morning, and the topic is legal assistance and will be virtual. We have a lot of great presenters already lined up for that, so we're excited for that as well. And of course, I'll send the follow-up schedule for the whole year as well. But you should have calendar invites. Let me know if you haven't received them. And then just quickly, just as a refresher, I usually send out the direct link to the Google Drive where you can access community announcements, events, things like that are going on that partners have sent us or that we come across for Davis County. And another way besides the direct link, which is long, is to go to davislinks.org, and then up at the top right in the navigation, there is a community announcements tab. So there's a red arrow on the screen that is pointing to that. If you select that, then you are taken to this page. And right here, it says community announcements. Visit the link below to view flyers for community events and resources. So if you click on the blue button right below it, and there's an arrow pointing to that for those that may not be able to see it, you're taken to the drive. So this Google Drive has all these PDFs of things that are going on. It's still a work so it's still in development as we learn from our partners the feedback. And so it's an ongoing process. But right now, how it's organized is that there's ongoing events, things like support groups and stuff like that fit in that folder. Resources by topic, some of the bigger things that people have, like food assistance, for instance, that isn't like a one-time event. And then there's trainings for you as service providers. So that's one way, and also for the public too, but mainly service providers. And then you'll see that there is PDF of different events in this just main part, and just wanted to make you aware of that. So currently, just to give you an idea of what's in the folder, like I mentioned, there's already trainings in there. There's community finance classes. There's support groups, like I mentioned. There's classes for people with dementia and their caregivers. There's food pantries and food distribution schedules. There's grief classes. There's safety and wellness events. There's volunteer opportunities, and there's more. So if you're interested in sharing a flyer with us, you can send it to me or to Davis Links Forums at daviscountyutah.gov. Okay. And then, oh yes, so where can you find these quick links? These are new. And I think I mentioned it at the last forum, but we have organized the resource directory resources so that when you go below the simple search, where you type in a category and a zip code, there's quick links to a curated list that we put together of programs for certain topics. So for instance, childcare. So on the screen, I'm showing childcare at the bottom of the screen. And so if you click on the accordion, then it will pull down childcare resources, and then also search for childcare providers, which is provided by the Department of Workforce Services. So let's say I selected childcare resources, then I'm taken to the resource directory, the Davis Links resource directory, and you can see in the screenshot that Davis Head Start and Title I Preschool popped up. So like we have organized all of this for the public and for you to be able to quickly access on certain topics like childcare support. So all the presenters, your programs are in the resource directory and in here. So I just might want to make everyone aware of that. It's something you can share out with others and access quickly. Okay, and I'll turn it back over to Shirley to introduce the presenters.
Okay, excellent. And I should have mentioned, my name is Shirley Griffiths, and I'm with the Discovery Family Coalition. And also, if you want to, if you have any comments or whatever, you can text those into the notes. And we do have, Joyce Kim is going to be monitoring the chat. So if you have any questions, feel free to use that, as well as to take your mic off. We'll have a Q&A after each speaker. So let's get started with our first presenter will be Lindsay Bootram from the Policy Project. And I hope I said your name right, but why don't you go ahead and tell us how to say it correctly? Thanks, Lindsay.
Yeah, no problem. I'm Lindsay Bootram. Close. I get lots of variations of my name, so no problem. Oh, I'm going to get rid of my little clock here. Sorry. So I am. Oh, I'm so sorry. I'm going to stop. I'm going to share. I shared the wrong screen. That's the problem here. Give me just a second, folks, to get my act together. Okay, that should be better. This is what I want you to see. So I am excited to be here, and I would love to know, if you all don't mind, I'm going to kind of glance, but then afterwards, like it'll help kind of me as I'm thinking for the end, and we can have a discussion maybe. If you could in the chat let me know what your role is, like as far as the service providers. I would just love to understand like the variety of people we've got here today. So if you could just pop in like your role or your what organization you represent, that would be really great. Okay, so I am here to talk a little bit about some policies that impact childcare availability and family affordability. Sally, did you have a question?
She said no.
Yeah. It was just
Sorry.
Google. No, you're good. Google Meet can be like a new landscape and territory for people. So
I appreciate that.
Okay, got it. Yeah, I'm happy if you do have a question. Go ahead and raise or interrupt me, no problem. Okay, so just want to give you a sense of what we're going to talk about today. So I want to provide just an overview of some of the policy initiatives we worked on this legislative session that impact childcare, and then and families and family affordability. Review some of the plans we have for implementing them, and give you an awareness so that you can use that for the people that you work with, and then identify opportunities to support and connect families. And so I'm kind of looking here. This is great. This is helpful. Thank you so much. Getting a sense of who's in the audience today. Okay, so let's get into it. First, I want to give you a background and curious, if you've heard of the Policy Project before, that's great. But I want to give everyone a little lens of like who we are and what we do. So we are a nonprofit, nonpartisan organization working in policy, and really we want to be able to use policy as a tool for good. And we believe in the power of community and try to engage communities in policy and in our legislative process. And so we've had different initiatives. Many have been in the education realm. This year was different because we kind of left education. We still, care very much about children, and our initiatives are supporting families this year. But a lot of people are familiar with our work through what was called at the time the Period Project, which was getting free period products in our school restrooms. And so that's in 2022 was the first law that was passed by the Policy Project. And then we went on to get funding for teen centers. And Davis County, you all are, I think, hopefully all of you are aware of teen centers in schools. All Davis School District, high school, and most of the middle schools have resource centers that provide concrete resources for students who need them. And that model, we saw the power of it. And so we've got some funding from the legislature, $15 million, to be spread throughout 72 projects in the state. And then we actually had a private raise that we contributed another $2.7 million to those same projects. And then in 2024, we worked on getting funding for child sexual abuse prevention education in elementary schools. And still working a lot on that initiative. And then in last session, or in 2025, last year, we worked to limit phone use in classrooms, so just requiring districts to have a policy in place, and then pass another one to expand access to no-cost lunch. So in Utah now, anyone who qualifies, any student who qualifies for reduced price lunch doesn't have to pay that reduced price. It's covered by the state through this initiative. And then this year we worked on family affordability, which is what I'm really going to talk about today. So, and just to give you a sense, this is kind of how our work flows. And I come in, my role is I'm the senior policy implementation manager. And so what that means is after we've kind of looked at a policy solution, considered what the community needs, come up with an idea, and then pass it through the legislative process, I step in to make sure that that's being implemented. So working with agency partners, working with community members and other organizations who care about that issue, to provide support and guidance. And then we care about, is this working? And so ensuring that impact. So looking at evaluating measures and seeing if the policy needs adjusted. So maybe there's something with the code that needs changed based on our learnings. And so this is kind of our process of our organization and how we look at policy. So I'm going to get into those legislative initiatives. And so we had a package, and this was very ambitious, this session. And what we really wanted to, we know that it's becoming harder and harder to afford a family in Utah, to raise a family. The cost of living is rising, food, basic supplies. And then childcare is a challenge for many people. There are areas in Utah that are childcare deserts where there just is not enough childcare, or there aren't enough childcare providers for the population. And then even areas where there are, those costs can be very high for families to afford. And so we looked at different ways to address this issue and coming at it from different areas. And we kind of had these, what we consider like 3 buckets. And so we went into the session with these ideas. Number one, to promote financial flexibility for parents. So using things like tax credits to be able to get more cash in hands so that families can have that to be able to use for childcare or whatever expenses for their family. Increasing access to higher quality childcare. We had a couple of ideas there, and I'm going to go into detail on one of these. And then supporting new mothers by extending maternity leave. And so this is what we went in with, and then this is kind of where we ended. So the highlighted, the ones that are still in bold, those are the ones that were successful in the session. So the 2 that didn't pass or we didn't get funding for was participation in family-friendly tax credits. And I'm going to talk about the tax credit. That's one of the ones I'm going to detail. But we tied into this idea of changing who can be eligible for the tax credit. We wanted to get some funding to help promote that and make people aware of those changes and their eligibility. And the request for appropriation didn't go through. So we're actually looking to do a private raise for that, to be able to still give some funding to this area, but it just wouldn't come from the state. The other one that wasn't successful was this effort to create startup grants for home-based childcare providers. We haven't given up, and we're looking at how we can incorporate this next year in the session. We think that this is really important, especially in those areas where there is not sufficient childcare. Home-based childcare can be a good option, and great for a parent who wants to have a home-based business. So this is something that we still believe in, but it just didn't pass this session. But the ones that did, I'm going to go into details, are the HB 290 and HB 190. But I do want to highlight the maternity leave. I'm not going to talk much about it, but if you do have questions, happy to discuss it. If you want to pop something in the chat or ask a question. But basically, we did it. We were going for 12 weeks extended maternity leave, but we got to 9 weeks. And then we also got, this is paid maternity leave. And for state employees. And then we do have enhanced protections for pumping in public. So breastfeeding is protected, but pumping was not. And so now it is. So I'm going to go into a little bit more detail about two of these policies. One is we call it the employer child care tax credit. So this was HB 190, sponsored by Jason Thompson and Senator Heidi Baldry. And so really, again, this is dealing with, we know that childcare is expensive. It can cost $1.36 billion annually, and it can limit workforce participation statewide. If you don't have a way to care for your children, you can't work consistently. So this is very important. And we know that employers often lack a clear, affordable pathway to support employees with childcare. So this is a really cool solution. So at the federal level, HR 1, the big beautiful bill, had some things related to employer childcare tax credits. And it's in the 45F if you're into like tax code. It's the 45F area of like federal code. And so this, what we did is the federal credit allows employers to claim a credit if they give childcare benefits to their employees. So what we did is we added to that. So the state is tacking on additional supports. And what that does is it brings, for a small business, they can get up to 80% credit for every dollar that they give as a child care benefit to their employees. So this is really attractive for businesses and employers. So it's a very small investment that they're actually making, but a huge benefit to employees, and can really make a difference in their recruiting and their retention of employees. And then of course there's great benefits for the employees and their families. And this can be, the bill actually expanded it to off-site provider contracts, which means the initial federal law and then Utah state law allowed for, you had to have a childcare center on site. And that's just not realistic for every employer. You know, small businesses to create and manage your own childcare is not simple. And so this now, that's no longer required. So you could contract with another provider, and even there are intermediary groups that can help support this by connecting providers and employers. And so it's a really creative way to get employers having a little skin in the game. And we know that even if 5% of Utah employers participate, there's potential of over 100,000 families benefiting from this. And so if we can get more, that impact is going to be greater. So in order for this to succeed, that's going to need some work. And the key barriers are really awareness. And so we want to make sure that employers know this is an option, and that they understand it. It might seem complicated at first, so we're going to do some work to simplify it for them and create messaging around that. Make sure that small businesses understand that they can take advantage of this. This isn't just for large corporations. And then we want to make sure that childcare providers are connected to employers and that they can have that relationship to be able to offer these benefits. And this matters because employers can be a part of the solution, and it really does support working families and workforce participation, and can really, again, take advantage of those federal dollars that are available. So one of the things, these are sort of the 4 areas that we're going to focus on. So as the policy project, we're working with lots of partners to work on messaging and employer tools. We got to spread the word and make sure employers know about this. We're going to do some outreach and work with chambers. And so if any of you have those connections, we would love to make sure industry groups, employer networks, that we're able to connect with those. So we'll be working with different people, and in the Davis area, trying to figure out the right partners to be able to engage with to spread the word for local businesses, and then partner with GoEO and make sure that they've got up-to-date information about this available for employers. And then engaging tax experts, because this is a tax credit. So making sure that that's all in line. And then I'm really excited. We're going to try to get a pilot cohort of early adopters. So businesses that want to do this, we're trying to gather them. And then we're going to provide some additional support to them over this first couple of years to kind of follow their progress and highlight and then share those learnings with other businesses. So that's kind of where it's important. There are some potential policy enhancements. So things we're looking at to kind of bolster this next year, maybe, or in the future, are expanding access. So looking at home-based providers, adding that in right now, because now it's center-based is really the focus of this credit. So we want to include home-based providers in this, which will help in rural and childcare desert communities. We want to strengthen provider supply. So make sure that there's some funding to support providers, and then improving market function. So making sure that there's addressing any gaps and issues that come up. So that's that one. And if you have questions, you can put them in the chat or raise your hand. I'm going to move on to the other initiative, but that's one of our main focuses right now. This other one, it's not exactly it's connected to childcare that's serving families, but this is a childcare tax credit or child tax credit expansion. So this was HB 290. Representative Tracy Miller and Senator Lincoln Fillmore sponsored. And what we know is that lots of families qualify for state and federal tax credits, or they would, but they don't actually claim them. And so there's a barrier of limited awareness and sort of gaps in filing assistance. So what this law does, this bill expanded the Utah Child Tax Credit income eligibility by $7,000. And so what this means, for an example, and if you're familiar with the tax categories, it all depends on your income, right? And your size of household. So let's, for an example, if you're married filing jointly for a family of 4, that's going to be, it went from $54,000 to $61,000 as your income limit to qualify. So there's going to be a lot more families that are eligible for this. And if you're head of household, single, it's going to be from 43 to 49. So those, and you can, looking at you'd have to know all the parameters to be able to see how a family would fit. But this is going to increase availability for this credit. And it's $1,000 per qualifying child of ages 0 to 3. And it's retroactive to this tax year. So people will be able to start claiming that at the next tax season. And we estimate that it's anywhere from 12,000 to 20,000 working families would now qualify. So again, barriers, awareness is an issue, and families might not know that the threshold changed. So they might think, oh, I've never qualified for this before, and I don't maybe have a lot of taxes, so I'm not going to file or not going to look into this. So really, we just need, to help spread the word so that non-filers, people who maybe wouldn't normally file, understand this is an option and can file. VITA sites are places around, and maybe there's some VITA site organizations here, but they are a filing assistance mechanism, but they have some limits and there are some gaps to what their capacity is. So that's a barrier as well. So again, we're working to try to get that $1,000 cash in pockets of families to help support childcare or other expenses. And so awareness is really important. And the 3 things we're going to focus on is awareness, working with those VITA sites to help maybe get additional volunteers or some more funding, and then getting a community referral network for service providers like you to be able to make sure that you're sharing that out with the people that you work with if they might qualify. And so kind of finally, to summarize, like what an ask might be is how to support this work. It's to help identify families and refer them. So flagging families who might qualify, especially those who maybe were just over the threshold before, and helping those people who maybe aren't used to filing their taxes to file, to consider having access to the tax credit, to direct clients to those VITA sites for free filing support and advice, and then helping with, any HR or business facing partners you have to raise awareness about that employer tax credit, and share messages through, many of you are trusted channels within the community. And so if you want to, we're getting started on all these resources. So if you want to stay in the loop and be aware of what's happening, as we get materials and information out, if you scan this QR code, and I can put in the chat, I'll put a direct link to this. It's just a simple form you fill out. I'm not going to spam you, but I will share updates as we get more resources and tools available. And then just want to say thank you for this opportunity. And if you would like to connect, here's my contact information. And if you have any questions, pop them in the chat and I'm happy to answer. Thank you very much. Thanks for all the work you do.
Thank you, Lindsay. That was great to hear the work that you're doing. Okay, we're going to move along quickly. If you have questions, please do put them in the chat, but we do have a very full agenda today. So our next presenter will be Janet Johnston from the Child Care Resource Agency. It says Northern here. So Janet, we'll turn the time over to you.
Okay, and it's actually going to be two of us presenting. Child Care Resource Agency works with the State Office of Child Care to help support their mission of providing affordable, quality child care for children in Utah. And we work with providers. We also work with families. And Lindsay, you and I need to talk just with several of the things that you said. Actually, we do have in Davis County 87 programs right now, child care programs. There are 51 family child cares, and then the rest, the 36 are centers. So there are centers in Davis County. One of the things that we do with families is we help them provide resources to find child care. And so what we're going to do today, it's on the link on the Davis Links resources that Travis was showing at the beginning, where it says search for child care. Brooke is our data specialist in our office. So she's going to walk you guys through how you would help somebody search for childcare. Just so you know, we have 5 sister agencies throughout the state. So every area of the state has representation that we provide support to them. So, and again, if you have questions as you go along, put them in chat or, contact me afterwards. I'll put my contact information in chat. And Brooke, we'll go ahead and let you take over.
There we go. Okay, so can everybody see the screen here? This is my first time sharing Google Meet.
We can, yes.
Okay, perfect. Okay, so this is the Care About Childcare website. I'm just going to walk you through how to find a childcare provider on the site. So depending on how wide your screen is, this part here, Parents Search for Quality Care, will either be on top or it'll be on the side. If you click on this Search for Care here, it takes you to this lovely page. Let me get this up. Okay. So let me scroll down a little bit and just show you some of the resources that are down here. This here talks a little bit about the child care quality system. It is a voluntary program for child care providers to participate in, and there's more information. You click on this, it will tell you all about it. We don't have time to necessarily get into that, but you'll see that when we search for care. It will tell you, who accepts subsidy, how to narrow down your search, anything. There's just some more resources down here. So let's get into this. So 3 ways to search. If you have a particular program in mind, and there are instances when somebody will have a particular program that they need to pick up their file, they can type that in there and click on search. But I'm just going to focus on, we don't have anybody in mind, we're running a search. So as an example, let's do We'll start with zip code. You can search by an address or zip code. We'll start with zip code. That's Layton. Click on search, and here it brings up a list. You'll notice on this map, there are pins. These are centers. The family providers are these kind of dots right here. It will give you the exact address for the center, not for a family provider. So looking at this list, you can either go by the map and click on the pins. You click on the pins, it rushes down to who that is. You know, if I live out here, I can click on this and it will bring up these names. Or you can just go by the list here. So say I'm looking for a licensed childcare provider. I don't care if it's a center or home, but I don't need after school. I don't necessarily need a part-time preschool. You can come over to care type and reduce your list down. So here I just clicked regulated centers and regulated family childcare providers, and it's narrowed it down to 13 providers there. So if you keep scrolling on the left here, just say I have a 3-year-old and I have a toddler. That narrowed it down a little bit more. Now we don't give out, it doesn't give out the exact rates, but you can search for a rate range. Say I can't afford to pay any more than, let's see, $12.50. And that brought it down even more. So there you got it narrowed down. You've got some centers and some licensed family providers. But let me go back here, take out zip code, and put in an address. This is, I believe, Layton High. You can search for a radius to narrow it down, or go 5 miles. Keeping these same search criteria, it's now brought up 28 providers. And that's because it's now not limited to just the zip code. So if they're having a difficult time finding a provider, I would actually put in an address. It doesn't have to be their address. It can be a crossroads. It can be a nearby business. But I would put in an address because you're going to get a better search. Or you'll get more providers if you put in an address. So let me take a look. Let me go back up here. So 2 things that I think you should look at is their quality rating. If they are participating in the quality system, you can search by that. You can search for any of these certified ratings. That means that they are participating. That's brought up 4. It looks like we've kind of left the Layton area though. So then you can see how to manipulate it. You can bring that up to 1,500. Now we've got some in the Layton area. You can use these filters here to connect, manipulate, and bring up, narrow the search down or broaden the search as much as you need to broaden it. Some of the things you can search by are these additional care options. These are mostly the hours. If they need a graveyard shift. Yeah, I didn't hold it for graveyard shift. Occasionally on Saturdays. Yeah, see how that kind of goes away. Some of these things are really difficult care to find. So if you wanted to do something like that, you may want to take off some of these other limiters. See, now we're back up to 35. And if you click on Saturday, we have some. So just use this menu to the left to kind of manipulate what we're looking for. So I'm just going to go back. I'm going to look in Layton. Just a 5-mile radius, centers, family providers, toddler, and a 3-year-old. We'll keep this limit at 1,500. So we've got 35 here. Maybe I can go back in and do this. Now that shows me those who are participating in the child care quality system. And I can look at the map. If I hover over this, it shows you where they are in the map. If you click on the map, it takes you, they interact, both of them. So let's say I live kind of up in this area up in here. So I've got That's Hazel, that's probably a little too far. Here's one in Layton, Portland. So let's take a look at one of the childcare providers. So if you click on that link right there, it brings you to their profile. So here you can see some providers have opted to upload photos. They've uploaded some photos. But underneath the photos, here's the basic information. There's the days and times that they do care. There's their contact information. Under that, you'll see an about the program. This is a statement that they have written and uploaded to their profile. All of this information is uploaded by the providers themselves. So it's all self-reported. Over on the right, you'll see the different attributes. They offer developmental screenings. These are the meals they serve. These will be the schools that they do transportation to and from. The additional care options on the side, if you were to filter for drop-in, open school holidays, you can see they have these set up there. And then you'll see the age groups. They take infant to school age. There are some centers that don't take, or facilities that don't take children under 2, and there are some that don't take school age, but this one takes them. This, I believe, is the most important thing you want to look for, the licensing record right here. You click on this link, it takes you directly to their public profile or their public licensing record. So you can see the date of any of the inspections they've had. Here they have one in January, unannounced, no findings. This one was announced, no findings. You can keep scrolling down. This particular facility has had no findings for the last 3 years. To get back, you do have to hit the back button in the browser. So that is a possibility. Now, active search results is over here. We'll take you back to some of these others. So if I want to stick with this area, right here, here's another something. So this one, they haven't uploaded photos, but they do have a program statement right there. Their hours a little more narrow. They open at 7:30. They go 7:30 to 6. These are the different schools that they serve. And they do infant school age. And then again, you can click on the licensing record. You go back as far as June 25, it looks like they have some findings there. And they tell you what those are. So that's kind of a basic rundown on how to use it. It's easy to play with, easy to search. One thing you may have noticed that there's not, if you go down to these additional care options, if you look at all these here, there are no options for special needs. So let me show you. If you have somebody that needs special needs, there is this program that is run by our sister agency up in Logan called All Means All. And it's a certification that licensed childcare providers can get about kind of surrounding special needs. This link right here, you can jump right in and take a look at the different providers. But if you want a little more information on it, you can go to this All Means All for Parents. And then this link right here will tell you what it is. They do have to have training. Center directors have to have training, and then any of the caregivers in the center can participate and get the training and get certified as well. Licensed family providers are also eligible to get this certification. So they have to have training. They have to write a statement that is posted on their Care About Child Care profile. They have to research and have a list of resources for in the community, the resources in the community for children that have special needs or families of children that have special needs. They have to have an expulsion policy, and they have to actively be working to implement the training that they have completed. And they also can get a grant to help them with materials for children. So that's a little bit about that program. Let me go back. This is the page, that little blue link that I showed you before, to jump right in to find a provider. There are 144 that are certified across the state. And this is organized right now by county. So please scroll down to Davis. These are the ones in Davis County that have that certification. So as you can see, we looked at kids first before. Here they are again. They do have this all means all certification. So this link here, if you click on it, it takes you right back into the Care About Child Care database. And you can check the lessons that you heard. You can check your days and times and all the other information that's there. And here's the statement. There, what they have in here is this compliance with the ADA. So, and if you want to go back, this will take you to Care About Child Care. If you want to go back to those results, you hit the back button and put your results again. So are there any questions at all? That was kind of a really quick rundown on that. How to use it.
I like that there were language options as well to see
Yes.
which ones provide English, Spanish. I saw Arabic potentially, Creole. So
Yeah. And we do have a lot that speak both English and Spanish if that's a need, and it can be a strong need. Yeah. You can search by that.
Well, excellent. Thank you to both of you. That was excellent. Okay, moving right on to our next presenter will be Heather Linehan from Davis Head Start, Early Head Start.
one second, Heather, and just
Okay. Hi, thanks for letting me come present today. I'll just introduce myself while we're getting those slides up. I am the Family and Community Partnership Manager for Davis Head Start. There are Head Starts in lots of counties in Utah and to the north and south of us with OWCAP and Utah Community Action also. So just to start with, to tell you a little bit about Head Start. So we are, our focus is definitely families and education, but we provide that vital resource for families too in childcare, similar to schools. They're learning and they're getting resources, but that's also a great place to have your child at while you're working or going to school as a parent. So we provide comprehensive services, meaning education. Our main goal is to have children kindergarten ready. So we have services from prenatal, so pregnant families, and birth to 3 is early Head Start, and then 3 and 4-year-olds, we have Head Start. Then we have health services, meaning we not only track children's well child and dental checks and immunizations, but we have resources we can provide for that, as well as nutrition. Then family services, each family has a family advocate that does home visits, make sure families have the resources that they need. And community, we make community partnerships to help all of this be possible. And Davis County is great to make community partnerships with. And so we can go to the next slide. I just wanted to show you a little bit about what we provide for families. So we have lots of family activities and they're fun, but we also have that educational component to that and the parenting skills. We try to provide education on parenting skills at each one of these, as well as concentrating either on literacy or math, things like that. So it helps to just see a picture of some of the fun things that we do. Our one at the dinosaur park at the start of the year will get 600 people. So as a side note to that, if any community partners ever want to come and have a table at any of those to provide their resources to our families, that would be great too. And you can contact me. Okay, next. Now about being eligible for Head Start. And this is great for those of you that are referring families, or if you're interested, just so you know a little bit what to expect. So we have a few different programs with the Davis School District, but I'll just be talking mostly about Head Start. So Head Start is for high need and low income families. So the way to be eligible for Head Start is if your family makes below the federal poverty guidelines, or if you have a foster child, if a family is experiencing homelessness, and we use McKinney-Vento, it is the guidelines that school districts have. So it could be a family that's doubled up or has substandard housing. It's not just living in a shelter. It's a little broader than that. or if a family receives TANF funds, so temporary aid for needy families. That can be SNAP. A lot of our families qualify with that, and they just have to provide that. That's the food benefits, or a family employment plan, or supplemental security income. And so a family just needs to be eligible in one of those ways. So if they receive SNAP benefits, we don't have to take their income. So a family can get on our website, the Davis School District website, and just search for early childhood. It'll give different programs, and Head Start's one of those, and that will lead to our application process. So after they complete that application, we'll set up a time they can meet with one of our family advocates one-on-one, and that's where we'll do that eligibility. And then we also assess family needs. So not only is a family eligible, but we want to see if they have certain things that would show a higher need for the program. And that's how we're going to enroll kids. So just a few of the things it could be if the parent had their first child when they were under 18, only one adult living in the home, if they have chronic health or mental health concerns, domestic abuse, incarcerated parent, things like that. So we go down that list and we explain to families why we would collect that information. And then we compile how they were eligible and their needs. And then we could go to the next slide. I just wanted to give you a little bit of an idea of the families that we served last year. And so as you can see, we do have a lot of families that are high needs. So these numbers are for our Head Start and early Head Start program. In Head Start, we enroll about 350 children, early Head Start 100. So out of that 450 total, if you look at the mental health concerns, we've got about 25% that report that. If you look at domestic abuse, about 10% of families are experiencing that. And so that's why we want those other resources to help a family with. Okay, we can go on to the next one. So after we have the family's eligibility and we've gone over those needs that a family might have, the children go on a wait list, and we always enroll based off of need. It's not first come, first serve. So we take these applications, and then when I go to do enrollment, they are ranked highest to lowest, and I place those with the highest need first. We enroll year round, so we have to keep our classes full. As soon as we have an opening, I'll look to that list to fill the next class, but we cannot over enroll. We can only enroll what we're funded for. So I know I have people that refer a family that is really high need, and they might be frustrated that they're not getting in, but we do have to wait for that opening to be able to place them in. And we do have very high wait lists, but I don't want that to defer anyone from sending families to us, because those higher needs will rise to the top. Okay, we can go to the next. So I wanted to know if there's any questions, and I can also, if you want our flyer to give out to any families, it's got our QR code that can lead them right to the registration. You can put your information in the chat too, and I can send that out, but it's also on Davis Links. It's on the website for the Davis School District. So are there any questions for me? Okay, now is our biggest time to send in referrals that you might have. The more applications we can get now, when I start doing the enrollment towards July, then that's the best odds of getting in. After that, it would just be if we have openings.
Oh, you have one question. What is your percentage of poverty for qualifying?
So we're at 100% poverty. So so below that or at that. So like for a family of 4, it's going to be between 25 and 30,000. I don't remember exactly. So it's pretty low. That's why a lot of the families we get qualify by receiving SNAP benefits or food stamps. But And we can go over that with families, how many live in the household and what that amount is too.
Okay. Excellent. Thank you, Heather. Head Start is a wonderful program. So thank you very much for presenting and giving us that information. Okay, next we will have Sally Willard from Open Doors and Imagination Station. So, Sally.
Thanks for having me. I'm
Thank you for
Sally
being
Willard.
here.
I work for Open Doors as the Imagination Station Nursery Coordinator for the last 28 years. Open Doors, our mission is to bring the community together to strengthen families and increase self-reliance. Offering a hand up, not a handout. Our family supports program includes the Imagination Station, and we take children ages 0 through 11, 3 hours once a week. It's a free program. The only qualifications are that you live in Davis County. And if you are seeking from outside our county, there are family support centers located throughout our entire state. 3 hours once a week. We also do parenting workshops, and we also have crisis care, which to qualify for crisis care, it is on a case-by-case basis. And it needs to be something important like a medical emergency, death in the family. Unfortunately for us, a lot of parents feel that if I don't go to work today, I'm going to get fired, which is a crisis by their criteria. But we are not allowed to take children while parents work or attend school. And that is because we are not a daycare. We are a respite nursery. Let's see. We do have a bunch of other programs, such as case management for self-sufficiency, our Circles program, housing stabilization, homeless prevention, and VITA taxes. And last year, well, since July 1st, 96% of our families have reported decreased stress. We had 669 unduplicated visits, totaling 4,240 hours of care. So I have received a letter from a client that I thought was pretty relevant. So I'm going to read it. I am writing to share how incredibly helpful Open Doors Imagination Station has been for me and my family. I have been taking my children there regularly for once a week for nearly 10 years. It has been a tremendous support in my life as a parent. I do not have family nearby to help with childcare because I'm an older mom with young children who also do not have friends whose schedule allow us to trade or share childcare. Most of my friends' children are already in school and makes consistent help very difficult to find. Because of this, Open Doors Imagination Station Nursery has been an essential resource for our family. Having reliable childcare once a week has allowed me to take care of important appointments, run necessary errands without having to bring young children along, and keep up with household responsibilities like cleaning. At times, it has even allowed me to rest and recharge by taking a much-needed nap. This break has been vital for my physical and mental well-being, and it has helped me be a more patient parent. The Imagination Station at Open Doors has provided a safe, caring, dependable environment for my children, and the impact it has had on our family over the years cannot be overstated. I am deeply grateful for the support they offer, for the difference they continue to make in the lives of family like mine. That is an impactful letter. It makes me feel good because when I tell you that she's been coming here for 10 years, this is a parent who has 2 sets of twins, 8 children. She is a parent that deserves to have, 3 hours once a week isn't a big deal. But it can make a difference in the life of these parents. So this letter shows what great support families. Sorry, it's the airplanes. If you didn't hear it, I did. This letter shows what a great support to families a 3-hour break can offer. I know that if parents understood the value of self-care, they can charge their personal batteries and have energy to deal with everyday life. The bonus with this is that children are in a safe, well-cared environment while they are having fun. I feel the more families that know about this free service, the better. Increasing family support, it helps our community thrive. And I hope that you can all help by sharing this resource with anyone who lives in Davis County. Now, having said all of that, I don't want anybody to get nervous. We are, in fact, relocating. It's about a mile away. Our new address is 438 East, 700 South in Clearfield. And the advantage to having this new building will be that all 3 of our buildings will be in the same building, and we will be able to provide our services to everyone. And we are on a bus line, which is important to a lot of our population. And that's it. Anybody have any questions?
No questions, but I love your program. I visited your first location, which was not very big, but you guys did what you needed to do, and I saw that your staff is so caring about and understand the plight of the parents. Because sometimes if you have a child and you're a new parent, and especially if you're by yourself, it gets really hard to, you need that respite care for yourself because you want to take care of your child the best you can. You do have a question. If you could repeat the address of your new location.
It is 438 East, 700 South in Clearfield. And I'm sorry that we do not have an exact date as of today. The renovations, as anybody knows, can take more or less time than anticipated. So we're working real hard to get all that taken care of so we can get started.
Well, excellent. Thank you, Sally. That was really wonderful to hear about what you do. And everything you said at the beginning, just really, that really hit home. So thank you very much.
You're welcome.
Okay, so our next and last presenter will be Michaela Houston from Davis County Health Department, the Top Star program. So Michaela, I'll turn the time over to you.
Awesome. Thank you. And sorry, my camera is not working for some reason, but that's okay.
Yep, no problem.
I'm just pulling up the slides right now.
Awesome. Okay, so the Top Star program, it's a statewide program that I'm here to talk about. If you want to go to the second slide. Okay, so Top Star stands for Teaching Obesity Prevention in Early Childhood Education Settings. It's a free continuing education program for like daycares or preschools or any other childcare providers, and it's designed to help them improve their policies around nutrition, physical activity, and breastfeeding in their childcare facilities. You want to go to the next slide. So some of the benefits of Top Star. So there's benefits for both the children and the families that go to a Top Star facility, and there's benefits to the facilities themselves. Some of the benefits for the facilities is they have that lifelong impact on the children in their care. They're teaching these kids healthy habits that they will use throughout their lives, and it's taken home a lot of the time to their parents as well, so the whole family can get benefits from learning more about nutrition and their physical activity. They have an increased marketability. So it's something that they can advertise around, that they are Top Star endorsed, showing that they put in work and an effort to better their policies around these things. And they're also listed on the state's website, on the state health department's website. So anybody searching for a Top Star facility specifically can find it on their site. They earn, I think it's 6 continuing education credits just by doing our training. And then they receive free resources, including assistance from us, newsletters, menus, lesson plans, posters, and whatever support they need. For the children and the families that are part of a Top Star facility, it teaches the children healthy habits while they're young, like I talked about, and it promotes a healthier environment through better nutrition and increased physical activity, and it offers breastfeeding support to the parents. If you want to go to the, yeah. Okay, so there's 4 steps to getting Top Star endorsed. The first is a pre-assessment. The assessment provides just kind of a baseline of where they're at with their policies. And it'll give them an initial score. And then from that assessment, they'll assess what things they can improve on. And so they'll make improvements to 2 policies around nutrition, 2 around physical activity, and then 2 around breastfeeding. So it can be simple things like hanging up posters of healthy food, or increasing the amount of time they get to go outside and play, or even like their staff is trained on breastfeeding once or twice a year. Can all be different policies that they can improve, or even just writing down their policies in an actual like written policy for the parents. That's also something they can do. And while they're doing this policy development, there's an online staff training from the state that the staff is required to do. If they're an in-home facility, they're required, everybody that works there is required to take the training. It's usually only 1 or 2 people. And then if it's a commercial childcare setting, then it's 75% of staff. But the training covers a lot about nutrition, like what kind of things the kids' bodies need to grow and develop. It covers physical activity and different activities that can be helpful in a childcare setting. And it goes over breastfeeding. And like I said before, that provides free education credits that they need to keep their license anyways. And then once they finish their training and the policy development, they'll do a post-assessment, which is very similar to the pre-assessment, but it shows the changes that they made in their policies. And once they finish that, then we award them their Top Star endorsement, and it lasts 3 years. And then we'll talk again in 3 years and they'll re-endorse. You want to go to the next one? So, like I said, it's valid for 3 years. And also, like I said before, that they're listed on the Utah Department of Health and Human Services website. That's kind of what Davis County's looks like right now. You can search by county, but it'll list like the name of the facility, who the main contact person is, their phone number, and then their star level. So the star level is just like the quality of how well their policies are. So like if it's super comprehensive and it covers a lot of things, they'll get 5 stars, which is the highest, and then it just goes down from there. But any of them are good star amounts. It's just a measurement. But that's all that I have. If anyone has any questions.
Hey, no questions? You guys all did such a great job presenting that we didn't have a whole lot of questions here. But if you do have any, you feel free to put that in the chat or unmute yourself. And I really, for any of our presenters, let's take just a few minutes here at the end for, a little Q&A for any of the presenters if anything has come up. A huge thank you to all of you that have presented. You did a phenomenal job. This was such great information and you did it very timely. So we all appreciate that as well. We will, if there are no questions, Joyce, have we had any questions in the chat?
No, none at all.
Okay. This is
Shirley, do you mind if I share something really quick?
absolutely.
Okay, since we have a little bit of time, I just wanted to mention something Shirley brought to my attention, which is this pyramid model. And what that is, and you can jump in, Shirley, if you have thoughts, but this is just one website that explains what the pyramid model in terms of child care and early childhood development. And so there's a video on here that you can learn more about, but the pyramid model is a framework of evidence-based practices or research-based practices for promoting young children's healthy social and emotional development. And so the pyramid model is for early childhood special education personnel, for early intervention personnel, early educators, families, and other professionals like yourselves. So it's been shown to be a sound framework for early care and education systems, and it's built upon a tiered public health approach to providing universal support to all children, to promote wellness, targeted services to those who need more support, and intensive services to those who need them. So I will link to that as well in the follow-up email so you can learn more. Shirley, anything you want to say more about that?
Yeah, absolutely. So with the pyramid model, I actually have been working with that program for the past couple of years. I am the parent engagement specialist. It is a wonderful model, and my focus on everything is always to engage parents. And so I've actually taken a lot of these resources and put them together in a tool to make these strategies and kind of the pyramid model resources available to parents as well. So any of you that that work with childcare, I would love to touch base with you and help make these. I don't know. I know funding, funding was cut or limited. We all know what's going on with funding and whatnot. That's always a thing. So I'm not sure how much they're able to expand right now. I know they're of course continuing with the programs that they were already working with. They may have the ability to expand. That's not necessarily an area that I'm in, but you can certainly reach out to Amy. And in fact, Travis, I'll provide you with that information. So, if this is something that you would like to involve the pyramid model in your program, you can reach out to Amy. But whether you are able to be an official part, the program is an official part of the pyramid model or not, again, I have a lot of resources that have been put together specifically with a focus on engaging parents. So this would be the child care program, Engaging Parents. It's been a wonderful way for the classroom to actually involve the parent, as well as for just in general for parents to have access to these different models and processes. So Anyway, yeah, thank you for remembering to include that, Travis.
Will you share the website? It's not showing anywhere on that. And when you look up the pyramid model, typically what you find is the Center for Social and Emotional Early Foundations of Learning. I haven't said it in too long. And it's not this website. It's looking specifically at like in a classroom or childcare program. I would love to see this website so I can look more into it.
Okay.
Yes, I put it in the chat, and it'll come out on the follow-up email as well. So technically, this what I did, it has a little hashtag which brings you to that part, bringing the pyramid to your program and getting started. I just realized, and so the generic one I can put in the chat too of that website, but it's the same web page. It's just bringing you down further in the page.
Okay, and then there's also on Utah State. I'm not sure which page you're sharing there, but okay, yeah. That's a more general. There's also one, and I will get that information to Travis for the Utah State, that the link for the pyramid model on the Utah State website, which is the pyramid model here in Utah is run through Utah State. And then just to be really clear, Janet, to make sure that you understand the pyramid model, really their focus is on childcare providers, and working with, specifically with teachers and, providers. My focus is always on involving the parents. So that piece about, having resources specifically for parents, there's not necessarily a website out there that talks about that. But that's more something that I have access to. If you would be interested in getting these resources to parents.
I would definitely like that. I've done a lot with the pyramid model based on CEFL, Center for Social and Emotional Foundations of Early Learning, which is geared, typically to how are you doing in your childcare program and your classes. So I haven't seen this geared to including families and community, and I would love to see some more information on that.
Yeah, that's kind of a thing that I brought to the program, because that's always my focus. Wherever I am, my focus is on let's get parents involved. So I'm going to add my email address to the chat. And yeah, if you'd like to reach out to me, I'd love to meet with you and share just whatever we have. So
it looks like Lori put an email a website, to the USU site.
Oh, excellent.
And then,
yes, thank you for finding that. Yeah.
Okay, yeah, and then I'm just going to put the link to the evaluation as well. Somebody just asked for it in the chat, but you can also scan the QR code.
Okay, excellent. Well, thank you everyone for being here today. This was a very valuable meeting. Thank you to all of our presenters. Thank you to Travis for all that he does to keep us all in line and moving forward. So thanks to everyone. Those of you that are here, have a wonderful day. And we will meet again. Travis, did you have any closing words that you wanted to add?
No, just the next forum will be virtual again, same time, but it will be legal assistance. And I just posted the direct link to the evaluation in the chat.
All right. Perfect. Thanks, everybody. Have a great day, great week, great life.
Thank you.